When I remove this skin with this wire loop, we flaked off all these little pieces of skin and they look like bacon bits. Didn't smell like bacon bits, but they look like bacon.
My name is Patrick Runyon, and I live in Lincoln, Montana. And I have a skin condition on my nose.
What is that? Well, that, my friends, looks like a very severe case of Rhinophyma, and this is the overgrowth of sebaceous glands of the nose. Let's keep watching and find out for sure.
My nose is red all the time. I started going to dermatologists and stuff, and they would tell me, okay, well, you have rosacea.
So for those of you watching who have rosacea, you may be looking at it and saying, oh my gosh, is this my future? And the answer is not necessarily. Rhinophyma is a type of rosacea, basically rosacea that has gone wild, and doesn't happen in the vast majority of people with rosacea. But if a certain type of rosacea is left uncontrolled, then this type of thing could potentially happen.
I would say about 10 years ago, it started really getting a lot of scar tissue. The width of my nose has gotten wider, and
to get a nose like this, it doesn't happen overnight. That's the good news. This is something that happens gradually over time, where you get this buildup of sebaceous tissue on the end of the nose. There are definitely things that could have been done to prevent this from happening to him, such as surgically treating it at an earlier age, or even putting him on potential medications that can help halt that process.
my nostrils have closed off quite a bit from the scar tissue. I guess you can see it here. I try to breathe through my nose, and the air passages aren't as large as they should be normally.
As you can see, his external nasal valves, which basically are the nostrils, have been pretty much closed up. So the first order of business would be to open up his airways and get him to breathe again.
Nice meeting you.
Nice to meet you too. I think I saw on your chart you're on a blood thinner.
Yeah.
Were you able to stop it? Somewhat?
I haven't stopped it, but I went to half a dose.
There are a lot of reasons why people get on blood thinners, including a history of a stent placement if somebody's had heart issues, to history of blood clots. And to take a half a dose of your blood thinner may still create major issues if you're going to have a surgical procedure. And that major issue is uncontrolled bleeding or hemorrhage.
Let me try to do this in a conservative and in a safe way. I'm going to try to numb up an area around your nostrils and try to take off some of that and see how well you heal and how well that skin looks afterwards.
So you're saying you just want to do a little bit right now?
Dr. Lee is a much nicer person than me, because if I were to have had a patient who's on a half dose of his blood thinner and wanted a surgical procedure, and understanding, he did come a far way to have this done, but he's still on blood thinners, I would have most likely just turned him down right then and there.
I'm going to use a really interesting surgical tool on Patrick today. It's called a loop electrocautery. It's where an electric current transfers to this wire loop and it heats it up and it allows me to cut tissue and it cauterizes the superficial blood vessels. So hopefully that will also help to control bleeding.
The treatment for Rhinophyma is to literally cut out that extra sebaceous tissue. Now, believe it or not, if you remove all of that kind of stuck on tissue that he's got at the end of his nose, he does have fairly normal skin below that, and it will heal. So there are a lot of ways to technically cut that tissue off. The benefit of a loop cautery is you may be able to get more of an even removal of that tissue, along with reduction of some of the bleeding. Now, if I were to do this in the operating room, I would either use regular cautery myself, or I would take a knife and just lop that baby right off. But it would then most likely start bleeding like crazy.
So what I'm going to try to do is really sculpt this part of your nose. You can see all the whiteheads. I mean, if we squeeze on the squeeze out, that's like whiteheads there.
Because Rhinophyma is a proliferation of sebaceous glands on the end of the nose, this creates that oil and that basically white cheesy substance that you're seeing come out of his nose. The good news is as she is removing this, he does not appear to be bleeding excessively, so that's a good sign.
It almost looks like little pockets of chipped butter. Got a good amount of oil under there that is wanting to...
Any of you want to take that and spread it on your toast in the morning? For some reason, as doctors, we always compare these types of things to food. There are so many different food-related analogies and comparisons in medicine that it's kind of gross. That loud sound that you're hearing is a smoke evacuator. Whenever you are cauterizing these types of lesions, it creates a lot of smoke. And in the past, people would just literally breathe that smoke in. But there are now some studies that show that it is similar to if you're breathing in, let's say, cigarette smoke, or even if you're breathing in barbecue smoke. And when you're doing that for hours every day, for so many days a week, for so many years, you can develop potential lung cancer and other types of cancers from it. So she is doing the right thing by sucking up the smoke and protecting herself, protecting the patient, and protecting her staff. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
So I've debulked both nostrils at this point, and I've decided to stop now. The numbing medicine temporarily constricts the blood vessels and minimizes bleeding.
A lot of numbing medicines that we inject contain epinephrine, and epinephrine basically will constrict blood vessels for a short period of time. But the problem is once that epinephrine wears off, those blood vessels that are constricted that weren't pumping blood into the area start to relax. They start to open up, and you can develop bleeding a couple hours after the treatment.
Look at how much bigger your nostrils are. I gotta take another picture of
I
that.
can tell I'm breathing better. For the past few years, it's been closing off my nostrils. And even this little bit that she's done today, the results are amazing. I'm breathing better already.
I'm gonna have him come back in a couple weeks and see how he's healing, number one. And number two, make sure that he is off his blood thinner for another treatment.
You've all had your nose stuffed up from a cold at some point in time. And when your nasal passages start opening up, it just feels so good to breathe through your nose. Well, imagine dealing with that for years. Could you imagine how it would feel like to finally get those nasal airways opened up?
How are you? How are you doing?
I'm doing great.
Did you miss me?
Oh, yeah.
Yeah? Your nose missed me, huh? I spoke to Patrick's doctor and we got permission for Patrick to stop his blood thinners. So I'm really excited to finish what we started.
Combining blood thinners with surgery is always a bit of a risky scenario. And when you take somebody off blood thinners that they're supposed to be on, you increase the risk of clotting. On the flip side, at some point he has to go back on the blood thinners. And when you go back on the blood thinners, even if it's a couple days after surgery, you have the risk of rebleeding. So doing surgery on people on blood thinners is definitely a risky prospect both before, during, and after surgery.
I'm gonna sculpt this. This is looking really good. I'm very excited about this.
It is a very odd sensation having the skin on my nose melted off.
Is it me, or is that just so satisfying to watch that skin just be peeled off? Little by little, as if you're slicing, let's say, a turkey or slices off roast or meatloaf. Once again, back to the food thing.
When I remove this skin with this wire loop, we flaked off all these little pieces of skin and they look like bacon bits. Didn't smell like bacon bits, but they look like bacon.
The smell of burning human flesh is something that, believe it or not, as surgeons, we do get used to. Now, when I first started doing surgery as a resident, and this was back in the late 90s, we didn't have these special types of suction and smoke evacuator plume type devices. I actually worked with some plastic surgeons who would tell you, don't suck up the smoke. And I don't know why. I think maybe they like the smell of it, but it really does gross you out when you think about it.
I think we're done.
Right now, I just got to believe that this was all worth it, all the pain and the traveling and going through everything. And a month from now, I'm sure it's going to be okay.
This does take at least a couple weeks to really heal. One of the main risks, however, of this surgery is going too far. If you go so far and you're taking it down, you're taking it down, taking it down, and you're not paying attention, you can take it down so much that, all of a sudden you see the cartilage of the nose, and now you've got some major issues. And that could even necessitate placement of a skin graft.
When I look at my nose in the mirror, it's a lot better than what I was looking at 4 weeks ago. Now that the Rhinophyma is gone, I feel more outgoing. This is a small town I live in. And I've had several people come up to me and say, man, that really looks good.
I just can't believe how fast it healed.
It really did. It healed right up.
Within days, it was cleared up.
It's great.
I'm happy with it.
Well, you've got that twinkle back in your eye. You look happy.
Big props to my buddy Dr. Sandra Lee for doing such a nice job for this gentleman. I mean, he looks incredible. Do you love watching Dr. Lee take these gross things off of people's noses and backs and arms and other parts of their body? Well, if you do, like myself, take a peek at this playlist that I made just for you. These are multiple episodes of Dr. Pimple Popper that I react to and give my opinion as a plastic surgeon. And if you've been enjoying these videos, please subscribe to my channel and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.